Now, one of the big stories today, we know that the NHS is in an absolute mess now. About 7.6 million of us on the waiting list. Absolute shambles and a disgrace. Notwithstanding it, though, the junior doctors have gone out on strike again today, 4 days this time. We know the details by now, don't we? They are wanting pay restoration back to 2008. That would be a whopping 35% pay rise. Now, the junior doctors have been given 6% plus £1,250, which works out on average about 9%. So I'm asking you tonight a couple of questions. Should doctors be able to go out on strike like this? Steve Barclay, the Health Secretary, he's saying that they are now risking lives. And I also want to get into the fact that I think there's a bit of a political element to these strikes. Do you at home? All of your thoughts coming in on that. But also joining me tonight for this debate, a registered nurse and writer, Sarah Jane Palmer. Hello and welcome. Thanks for squeezing in. We like that. I'll start with you because you are a registered nurse and NHS is in a mess. I've just been describing it. I won't go back over it. So do you actually think that doctors, nurses, etc. should be able to go on strike?
I think it's morally wrong. I can't see how that there could be a justification for it, because even though it's important that doctors and nurses are paid fairly, but then again, I think the health of your patient comes first. And I think it would cause unnecessary suffering by going on strike. You're abandoning your patients, you're causing the waiting lists already at an all-time high of 7 million to increase even more. And that causes long-term damage as well down the line in a couple of years.
But they would say, a junior doctor would turn around and say, well, yeah, you know, I might be putting my patient at harm, but the patient could be a lot more harm if I decide that I can't afford to live in this role and off I go.
They say that, yeah, but I mean, to attract people by having a more lucrative salary, you might attract people into the job, but it doesn't keep them. Staff retention relies on, I think, cultural issues to be resolved. So I think currently there's quite a bad issue with bullying in the NHS, and there's other issues that need to be resolved. And I don't think that can just be resolved through pay alone.
Well, Paul, you are a staunch trade unionist. Sarah Jane, they're saying it's morally wrong for doctors, etc., to go on strike. Do you agree with that?
No, I don't. I mean, I've been in a position as an emergency service worker where I've voted for strike action and I've taken strike action.
He's a firefighter, by the way.
And it's never less than a genuinely agonising decision for anybody in that position to have to make. And you do wrestle with your conscience. And, you know, trust me, people in that position, and I'm sure junior doctors, would only decide to take strike action if they feel it's a last resort and if they feel they've got a legitimate cause.
A last resort? I think this is their 5th time or something. How many times is it a last resort?
The point that I'm making is taking strike action in the first place is a last resort. If you've made your case, if you feel that, you know, you haven't been able to persuade your employer as a result of negotiations, sometimes you've got that final weapon and sometimes you have to use it. And the problem is this: if you were to take away that weapon, then imagine what governments and employers would do then. I mean,
I don't like the word weapon. We're talking, Claire, we're talking about, like, he's sitting there saying, oh, if you take this weapon... These are people's lives, life and death situation. Weapons, really?
No, but the right to strike is a very important civil liberty, and I'm not going to throw that over for anyone. I mean, we have to be able to withdraw our labour, whatever job we do. It doesn't mean that I support necessarily each and every strike that happens, but you asked... should it be, as it were, banned? Should they be allowed to?
Police, for example, they can't go on strike. Some of the armed forces, the prison officers. Do you think that they should be able to go on strike?
Well, first of all, I don't necessarily agree with the ban on the right to strike for those forces, but what I am saying is I don't want it expanding. And where would you draw the line? Because you could draw the line on every single public service worker would say, oh, well, I have a life in a hand like the fire services, we've said. But listen, just to go on to the particular issue, I mean... I think that one of the problems here is that most of us perceive that the problems of the NHS are not just to do with junior doctors, right? The government trying to say it's junior doctors are putting lives at risk, I think is really not on, because at the moment the NHS is in a complete mess, and I hold a wide range of people responsible for that. We've just talked about what you would do in a serious situation. The waiting lists on non-strike days, largely supported, by the way, largely created in the modern period by the lockdown measures, which the government went for, the opposition went for, and I'm afraid the health unions went for. Those things, I think, are problematic, do need to be tackled. need to be at least accepted, and then we need to act as though there's something crucial going on. But the individual doctors are not trying to kill people off. That's a horrible accusation.
The fact is, though, the waiting lists are being made worse by the strikes. So you're quite right to mention that the waiting lists require attention. But the fact is the junior doctors are genuinely making it worse by striking. And I think it's ridiculous to ask for 35%. Do you think that's reasonable?
I think that look, I'm not in that union. What you demand as an increase in your pay rise, or what your particular union demands.
Yeah. You must have a view on it. They're asking for 35%.
I can understand that what they're saying is we haven't been paid fairly for many a year, and we're going to demand it. But I'm saying I would actually say that there are things that could change in the health service that would make it more efficient, and I would like workers in the health service to contribute to changing working conditions. But I do support the right to strike for an increase in wages. It's very important to defend.
Let me say, something caught my ears this morning, so it did, and I'm going to play it for you in a couple of seconds, because this was on the Today programme on the BBC, and it was a conversation there about these strikes, and this is Dr Robert Lawrenson. He is the co-chair of the Junior Doctors Committee at the BMA, and they were talking about the situation in Scotland versus the situation in England. So just have a little listen.
Absolutely, you would not accept the kind of deal that your Scottish members are thinking of accepting?
No, because the governments are very different. So the Scottish government, there's a basis to work forward and have a relationship and a working relationship to negotiate in the future. The government that we have today are hell-bent on using the rigged independent pay review bodies to suppress our
really,
pay.
if I may say so, it sounds very, to a patient who is not able to go to hospital today, has had something cancelled, who's desperately worried, possibly in pain, it really does sound ideological, the reasons why you won't do the kind of deal with the government, with the Westminster government, that they seem to be willing to do in Scotland.
So I think what's ideological is the government cutting our pay for 15 consecutive years.
See, I listened to that, and you can listen to it yourself back if you want to. It's a Today programme, Radio 4, it was this morning. And that really pricked my ears up, because I thought there is an element of this, in my view, Paul, where it's not just about paying conditions, it's not just about terms and conditions, it's about the fact that you don't like the Tories. And I feel that what's going on now will strike and strike and strike and strike, will just kill time to make sure that actually by the time we get to the next general election, Rishi Sunak is battered by the NHS.
No, hold on a second, Michelle. Look, we're not living in the 1970s where a trade union leader could say everybody out and everybody had to down tools and walk out of the door. To get strike action off the ground today, unions have to go through very complex procedures. It takes several weeks, and they have to have a democratic secret ballot of their membership. The idea that junior doctors have all woken up one morning and decided we hate the Tories, we're going to take strike action.
Do you think 35% restoration is realistic?
Well, first of all, that represents the amount that their real wages have fallen off a cliff since the global financial crisis.
It's realistic,
and it's an opening gambit. I mean, of course they're not going to get that, and they're not expecting to get that.
But they're saying they won't go to the table. So in Scotland, they've got something like 12 points something. The BMA are insisting this. And I don't mean to be rude, by the way, but when I look some of these junior doctors up, they're very young people. I respect the work that they do, but they went into this profession way post-2008, knowing the wages that were on offer at that point in time. So if you ask me, I think it's a bit rich to now sit there and say, you know what, I've joined this profession, but now I joined accepting the T's and C's and pay as it was, but now I'm going to down tools unless you give me the pay that it should have been all these years ago. I don't know, maybe I'm wrong.
Michelle, we're in a cost of living crisis as well. I mean, when they joined, they didn't know there was going to be a cost of living crisis.
We're in a cost of living crisis, and that means we, as a channel, have got to pay the bills. With that in mind, let's have a look at the weather.